Knock, knock. Hi, Tom. How are you today?
Hi, good.
Good. Tom, my name's Cori. I'm an occupational therapy assistant student from Austin Community College. And I'm here to work with you for a little bit today. But before I get started, I'm going to set some things down. Tom, can you tell me your full name?
Tom Green.
Tom Green? Tom, do you mind if I take a look at your medical ID bracelet? Good, I got your date of birth on there. Looks good. Tom, before we get started, I just want to check my environment a little bit. I'm going to move a few things. Do you mind if I pull up a stool?
Sure.
Okay. And Tom, just so I can see it a little bit better, I'm going to pull this down. So Tom, the reason I'm here today is to work with you on getting your lower body dressed using both of your arms. We're going to try to integrate some external strategies and some adaptive strategies for dressing so that we can work on your judgment and safety when you're doing your daily living tasks. And also we want to work on your attention and awareness along with your short-term memory. Does that sound okay with you?
Yeah.
Okay. Before we get started today, a couple of things. I think I don't know if I asked you, are you having any pain today on a scale of 0 to 10?
No, just a little tight.
You're tight, or is it your shoulder that's tight, or just mainly your arm?
In my arm.
Your arm? Okay. Well, during our session today, we're going to work on that tightness a little bit so that we can use your arm. But if you do have any pain, I want you to let me know so we can stop. Okay? The other thing is during our time together, I am going to have to place my hands on you a few times, mostly on your shoulders, a little bit on your arm and hips. Is that all right with you?
Yes.
Okay, good. The whole thing should take about 25 minutes. We're going to get you up and dressed for PT, and then we should be good to go. Are you ready to get started?
Yeah.
Okay, good. So we want to get you out to the edge of bed. I see that you have on non-skid socks, so that's good. We always want to have our non-skid footwear on for safety. I'm going to get you to the edge of the bed and get you sitting so that we can start working together, okay?
Okay.
So first thing I'm going to do is I'm going to move some things just to clear the space. And I'm going to bring you up a little bit, okay? So I'm going to bring the bed up so it's safer for me. Okay. So Tom, first thing I'm going to have you do is I want you to bend this leg. Good job. And then with this arm, I want you to reach across towards me. On the count of 3, I'm going to have you reach and roll over to your side. Okay? Are you ready? 1, 2, 3. Good job. Okay. I like where you have your hands here. We're going to scoot your knees up just a little bit. Okay? And then on a count of 3, what I'm going to do is I'm going to push down on your hip. I want you to bring your legs over. And I want you to push on this hand to come up to seated. You understand?
Yeah.
Okay, 1, 2, 3. Oh, good job, Tom. Okay. Now we got to get you back down so that you're safe. Maybe. We'll see if the bed wants to agree with us today. Okay. One more thing before we get started. I'm going to put a gait belt on you today. This is for your safety and mine, so that we don't have any falls. Okay? How have you been doing?
Very good.
Yeah? Are you looking forward to going home soon?
Yes.
Yeah?
Right.
What are you looking forward to doing at your house?
Just nobody talking so much.
Oh, not so much talking? Yeah, I understand. Let's see if I can tuck that in. Okay. It may or may not stay there, but How are you doing?
Good.
Okay. First thing I want to do with you today is I want to address this arm because I want you to be able to use it during our session together. So, I brought, we can always use this little sheet as a guide on the wall. So it's about pacing yourself. So I don't know if you've noticed when you've been working with other OTs and PTs lately that sometimes when you get stressed out, everything starts to tighten up in your arm. Have you noticed that?
Yes.
Well, today I want you to just think you have an option here. So if you feel tired, if you feel mad or sad, you can see my little emojis. We're going to try to use the 3 S's. So I want you to stop, I want you to slow down and take a breath, and then I want you to start again, okay? So this goes for any time you're doing something here or at home. When you go home, you find yourself getting kind of agitated that you can't do something, I want you to think of stop, slowing down, take a breath, and then start again, okay? So I'm going to put that right here, and then we can find a place for that as a reminder, okay?
Okay.
It's a good strategy. First thing we're going to do, and we'll introduce that in a second, is I'm going to get in a little close to you here. And I see that your shoulder looks a little more relaxed. So is that feeling a little better back here? It looks a little lower, so it's not super tight up towards the ear. So I think what we're going to focus on is getting your tricep to extend, giving a little stretch to the arm, and then I'm going to have you help me undo your hand, okay? Okay. So what I'm going to do is, the first thing I'm going to reach in here, just to start to get you to help me with your tricep. So as I tap on the back of your arm, I want you to think of contracting that muscle, okay? Are you ready? So think of extending the arm, using that muscle. Good job. Okay, way to go, Tom. So now what we want to do is we want to do a little prolonged stretch, okay? So as you get better at extending that arm, relax and then stretch it out. So I can give you, in the next few days, a couple of stretches that we can work on that you can do for yourself to help do stretch, okay? One more time. The arm. Okay, good. Okay, so the arm is looking a little more extended. Tom, what I'm going to do here is I'm going to bring this and right here, okay? Let's see if I can get it under your arm. And then we're going to position the hand where it's kind of hanging over the edge of this towel. You could use a table or an armrest, so when you let the hand hang, it starts to relax some of this tightness in the hand, okay? What I want you to do with your other hand is you're going to come in and you're going to try to gently work your thumb out from inside the hand and place it on top of your first finger. That's your first finger. So you want to be gentle, you want to be careful when you take that out. Nice. And place it right there, okay? And then what I want you to do is you're going to take this hand, your right hand again, you're going to hold on to just gently around the wrist here, and then you're going to bring these fingers up, and you're just going to glide them up the hand into your fingers here, and you're going to start to work the fingers into extension. Nice. So this is a place where if it starts to get frustrating and it's tight, because sometimes this isn't going to work as easily, you want to pause, you want to take a stop, slow down, and then start again, okay? From here, we're going to gently remove this. Now that the arm is extended, I want you to place your hand on your knee. Good job. Okay, Tom. So Tom, I noticed that you are wearing pants and underwear today. You got partially dressed. Did you notice that? Did you know what clothes you were wearing today? You didn't know what clothes you had on today? No. Okay, that's all right, no big deal. I did bring a little external cue for you, okay? So I know sometimes when we're getting dressed, there's a lot to think about, right? Sometimes, I know before you've said that you just like hanging out in your boxer shorts and watching TV. Yeah, that's your most comfortable space.
Yeah.
Well, today PT appreciates it if you put pants on, okay? So, can you tell me, in getting dressed safely, do you know if you should dress your affected side first or your unaffected side first?
Yeah, I know how to get dressed.
Do you know how to get dressed? Do you think that you should dress, which side? Can you point to which side, or can you tell me which side? This side or this side? Do you think you should dress first? You know? Okay, good job. That's good. So that's your affected side, okay?
Yeah, I don't do it that way.
You don't do it that way? Why not?
I just know how to get dressed.
Okay. Well, here's the thing, Tom. When you go home, what we want to have you do is we need you to be safe, right? So you're going to be at home. You're going to have your 3 kids, and we need you to do safe dressing techniques so we can send you home, okay? So one way to get home as soon as you want to is to do strategies that are going to help keep you safe, okay? That means safety for both the limb, because we don't want to injure yourself, and we also want you to be able to practice other occupations safely as well, okay? So it's a little cue, it's a reminder, you've got to dress this side first, okay? So we're going to practice it today, okay? So you said you weren't sure what you were wearing. Do you think you have underwear on? Can you look and see? Do you have your underwear on? You look like you do to me too. Okay. What about a shirt? You wearing a shirt? Okay. Pants. Do you think you have pants on today?
I don't know where they are.
You don't know where your pants are? Well, I'm here to help. Okay. So Tom, I want you to look around and see if you can find your pants.
I don't know.
Okay, you don't know where they are? What about, did you look onto this side?
Oh, they're there.
There's the pants. Okay. So I'm going to lay your pants out right here. Could you reach over and get your pants for me? Okay, good. Okay. So I'm going to need you to slow down now that you got your pants. We're going to keep those right there for a second. Okay? And then what I want you to do is we're going to work on an adaptive strategy to get your leg inside your pants. So I know you told me you know how to get dressed, and I trust you, okay? But I just want to show you a technique that I think would be helpful. Are you okay with that? Can I show you a technique?
Yep.
Okay. What I'd like you to do is I want you to take this hand, you're going to reach down for your left leg, and you're going to bring it to your knee. You're going to bring this leg to here. Okay, reach down. Good job. Now, how about you take this hand and you let this, you come over and take a hold of your left hand there and maybe slide it down, right? Now we're using this arm. This is how you're going to get your function back into your arm. You got to use it, okay? I'm going to give you a little assist here to make this easier. Okay, so I opened up the pant leg for you. When you're at home, you want to try loose clothing, shorts, something that you can open up the pant hole easily, okay? So now you can use this hand. You're going to take a hold of the pants, and you're going to place your left foot in there. So what side are you dressing first?
My left side.
Your left side, right. So this is your affected side. You always want to dress it first. Now, how about we take your right hand and tuck it into the pants into your left. Good job, okay. And now you can slide this leg out. Place your feet on the floor, okay. And then how about you use this hand right where it is, hold the pants, and now you can dress your other side. Your unaffected side. Got it? Let's get it untwisted there. So sometimes those non-skid socks are a little tricky. Okay. Okay, good job. So you get them up as high as you can. I want you to stay right where you are, okay? So just before we get to standing, just as a reminder, which side do you dress first for safety?
Left.
The left side, okay. This is a little tricky. When you get undressed, you have to undress your strong side first. Think of it like this, Tom. When you're getting dressed, you got to adhere to your OT's safety and get your left side first. When you get undressed, get comfortable in your underpants watching TV, you get to undress your strong side first. Okay? Okay. From here, what we want to do is I want to get you with your pants on, and we're going to get you over to the chair and get you ready for PT, okay?
Okay.
So, before you come up to standing, I'm going to move this. You bring your hemi walker over, and I'm going to sit down next to you. I'm going to place my hand on your hip over here, okay? I'm going to give you a little assist on your pants, okay? What I want you to do is I want you to interlace your left hand with your right, okay? So I know you've been doing this, getting up, so what you're going to do is you're going to lift those arms up, right? You're going to look up, and then on the count of 3, we're going to bend forward and stand up. Are you ready?
Right.
Okay, 1, 2, 3. Good job. Now you want to reach down for your pants. Okay, you pull your pants up. So I like the way you're using that left hand. Nice. You want to try to use that left hand. That's what's going to give you back the function. Got them on?
It's a little crooked.
You're a little crooked.
There we go.
Okay, good job, Tom. So can you reach over for that hemi walker for me? Now, before we get started, can you tell me how you're supposed to use the hemi walker? You push it forward.
Yeah. Just do the walker and then step to it.
Oh, nope. Will you bring it back? Can you bring it back for me?
Okay.
So I want you to take, you're going to push the hemi walker forward one effort, and now you're going to move this leg first. You're going to step forward with your left, and then your right. Okay?
Okay.
So what I'm going to have you do is we're going to go this way a little bit, so we can turn around into the chair. Good job. Okay. I'm going to pivot myself a little bit. Can you pivot? I'm sorry, I'm a little clunky right now. And pivot one more time. You. Okay. Come, on the count of 3, you feel the chair on the back of your legs?
Yes.
Okay. I'm going to have you lean forward, reach back, and sit. Okay, so you can let go of your hemi walker. Are you ready?
Ready.
Okay. 1, 2, 3, reach forward. Okay. Good job, Tom. How do you feel? You got your pants on?
Yeah.
You're ready for PT, excuse me. Comes out on the OT there.
Yeah.
Good luck. Okay, Tom. You did great today. Okay? So let me loosen your gait belt just a little bit so you're more comfortable. Okay. So, a couple of things to go over again. So can you tell me about pacing yourself?
If I'm tired or mad, I have to stop
Mm-hmm.
and then breathe.
Yeah.
And start again.
Start again. Good job. You just want to slow down and start again. So that's pacing yourself. I'm going to put this in your folder for home exercise. So this is going to remind you how to open your own hand. Okay? We want to use that hand as much as possible, okay? So you did a really good job on opening your own hand. That shows me that you can use both of your hands together. This is really good for your movement, your voluntary movement. And you were able to tell me some of the sequencing that we're doing, so it means you're paying attention, okay? The one area I'm thinking we still need to work on a little bit is your safety, okay? So when you were telling me about dressing yourself, I understand that you know how to dress yourself, but I need you to do it safely so that when we send you home, you're able to take care of yourself and you're able to be there for your kids and your wife, okay? Okay. So what I'm thinking is tomorrow, when I see you again, because we got to get you ready to go home, is that we're going to focus mainly on safety strategies. Okay, so how to keep ourselves safe when we're doing different things like getting dressed. Maybe we can go into the bathroom and practice some hygiene, and then we'll just really focus on doing those things safely. Does that sound okay to you?
Mm-hmm.
Okay. Do you have any questions for me today?
No.
Okay. Okay, well, I see that PT is here. So I'm gonna pass you off to them. And if you don't have any questions, I'll see you tomorrow. Once again, I didn't do my hand hygiene at the beginning of this, but I'm gonna do my hand hygiene at the end. Okay, and I'll leave those with you, and let me clear my environment out. Take my stuff, my hand hygiene, and my paperwork, and I'll see you tomorrow, Tom. Okay, thank you.